And welcome back. Well, women between the ages of 35 and 50 have to juggle a lot, right? A career, a family, a household of aging parents. And on top of that, you probably notice changes in your body, your emotions, your hormones. But our next guests say that taking proactive changes now can have a positive impact on your future health. So joining me now is Dr. Allison Nelson and Dr. Jessica Herzberg from Moreland OB-GYN Associates with preventative care for women 35 and over. Listen up. This is all of us. Good to see you guys.
Thank you. Thank you for having us.
Yeah, this is great. So I think the thing is, you know, we think about that age frame, this 35 to 50 and plus kind of being a time when there's so much going on in our lives. And you guys say there's a lot we can do in this age frame to impact our future health. What kinds of things are we going to be thinking about between that age?
Sure. So I agree. You know, I feel like as women, we take on so much between our households, our jobs, our sometimes, you know, families in general, that things that we can focus on are just really working on ourselves. So getting in to see your doctor, talking about your concerns, making sure that you start healthy habits, something as simple as exercise and a diet that works for you. Going in, talking about your concerns with your periods, if those are changing, talking about what other things you can be doing at this stage of the game so that in 10 to 15 years or more, you're still using those to keep yourself healthy.
Yeah, because the thing is, between this age frame, we're not quite menopausal yet for the most part. Most women are not. So what do we need to know? I mean, women, if we're not menopausal, then what types of things are we looking for?
Right. So that period of time as patients are and women are approaching menopause, we term it perimenopause, sort of this period of time as hormones are starting to change and women are approaching menopause. And the symptoms that come with that, generally what patients will start seeing is changes in their period, irregular bleeding, spacing out of their periods. A lot of those concerns come to us as gynecologists, but then in terms of mood changes, metabolism changes, all of that can sort of be wrapped up in that perimenopausal time.
I mean, there's not a single woman that I talk to that's like, I just can't get these 10, 15 pounds off. It's like, it just changed overnight. And I'm sure you hear those things, and there's so many things wrapped up in that. So as we talk about health risks or changes with our health, what kinds of screenings or are there tests, things that we should be asking for, talking about with our gynecologists over 35?
Definitely. So, you know, starting off with our, you know, breast and pelvic health, making sure that you're getting your Pap screening as appropriate to your risk factors and your previous Paps in the past. Also, we want to make sure mammograms are started. Those are typically started around age 40. And then looking into things like cholesterol screening. You know, in someone who's healthy, it might be recommended every 5 years, but talk with your doctor. Make sure that you're telling them what your family history risk is. Also looking into thyroid screening. Diabetes screening is another big one. So all of these tests can be done with us or your primary care, and it's, you know, easy as a blood test that you can go and get.
Are they things that we have to ask for, or would you guys actually suggest those to us?
Typically, they're going to come up in the course of just good preventative screening for everybody. I think what's unique about this age range that we're talking about is that these are a lot of tests that you don't necessarily get suggested in your 20s, but it becomes more important as you sort of get into, you know, as you approach your mid-30s, particularly some of the lab work, checking cholesterol, things like that, where it just becomes much more apparent to have kind of a handle on what your test results are.
Yeah, I always think it's nice if you've done some of those in your 20s because you almost have this baseline of this is where your body was, but that doesn't, it's not always the case, as you mentioned, so you really need to know. Another thing women are really feeling is hormones. We know that hormones change as we age. Sometimes we feel the fluctuation in our emotions or things like that, especially throughout the course of a month. But what do we need to know about hormone decline, what it means for us as we age?
Right.
Sure.
So with approaching menopause, what drives that is changing hormones and changing hormones in terms of estrogen and progesterone. So estrogen is a hormone that plays a big role in bone health, heart health, brain health. And progesterone, really, when we see decline in progesterone, that's where those irregular periods, irregular bleeding comes from in perimenopause. We talk with our patients about these changing hormone levels. There certainly are going to be some symptoms of menopause and perimenopause that are well treated with hormones, but certainly there are other lifestyle modifications that can help some of those other symptoms of menopause
That's
and
great.
perimenopause.
Because sometimes people don't want to take a hormone. Other times you want to balance yourself out, especially if you're really not balanced. So it's, you know, it's a personal approach. Like you said, a lot of people will decide what they want for their own health. But I think a lot of us, as I mentioned, you know, with weight and health, you know, I always wonder from a doctor, is there something that you see that works for women health-wise, or, you know, food regimen or things like that, especially when we talk about weight gain? Is there something that you see over and over for nutrition or health? Because a lot of us fall for a fad. You know, we fall for a fad diet, hop on the next train that's coming out. But do you see something that time and time again works within this age frame?
Definitely. I mean, I think when you figure out what exactly works for you is the best, but also making sure that you're picking fresh vegetables, fresh fruits, making sure, you know, those whole foods, good calories, and it's easier to stick with than a fad, because if you're cutting out a whole food group, it's harder for you to continue with that. It's easier if it's stuff that tastes good to you, that, you know, works with your body, and, you know, adding in exercise. If you're gonna eat healthy, you might as well exercise.
Yeah, it's good for your heart. It's good for everything.
Exactly.
It's great. You guys have these incredible videos. You've got free resources, including a health assessment quiz, exercise and nutrition plans, a tip sheet, and so much more. It's all free at the website morelandobgyn.com/health. And this is all preventative health care for women ages 35 to 50 and plus at Moreland OB-GYN. Thank you so much for being here. Great
Thanks for
conversation.
having us.
Thank you so much for having us.
Appreciate it.